Hi, we're discussing mood and substance-related disorders, and I'm pleased to have joining me in this discussion is Dr. Rajiv Tony Juneja, who is a practicing psychiatrist. Thank you, Dr. Juneja, for joining us.
Hi, Janet.
Dr. Juneja, let's start with mood disorders. Could you please define for us what a mood is? Quite often we hear, I'm in this mood, I'm in that mood,
right.
And it could be lighthearted or get out of my way, I'm in this mood.
Right.
But could you help us understand what that
really when we're talking about a disorder, right? So we're not talking about kind of the day-to-day variations that we all have. Really, we're talking about over an extended period of time. The way I like to think about it is kind of like the seasons. So we're in the summer season, or we're in the fall season, or we're in the winter season. What's the season of the mood overall, right? So now if somebody is depressed most days, and it's been 6 weeks, it's been 8 weeks. Now we're talking about, does this person have a mood disorder? That this is where they live a majority of the time.
Big difference.
A big difference versus, somebody gets in a car accident, for example, and they're feeling upset about that. Which next week their car gets fixed, they feel better, So
you've defined that this individual has mood disorder. And how would you go about treating?
Well, it's, the two main avenues to treatment for most psychiatric illnesses are going to be medication, so addressing the biological aspects, as well as psychotherapy, which can take a variety of forms now. There's group therapy, individual therapy, but addressing the psychological piece. So both are important. Research shows that the medications work. Research shows that the therapy works, and what works the best is some combination.
Now, if I'm a family member and I'm noticing changes with one of my loved ones, or I'm noticing a change with myself, is it something that gradually comes on, or is it something that all of a sudden there is a change in mood?
It can be both. It can be both. So say, for example, if it's a drug-induced state, that can be very quick. That can be very rapid overnight. So if you notice something is different immediately, last time you saw your 22-year-old son, he was okay. Now he's paranoid and talking about seeing. That could be very well drug-induced. Versus, somebody that quietly slips into a major depressive episode.
I see. Now, what are some of the major mood disorders that are diagnosed today?
I would say that really the two biggest ones really we think of are major depressive disorder, in which somebody meets the criteria, which is really 2 weeks of a depressed mood, along with other various symptoms, including decreased eating, decreased concentration, suicidality. But if you meet all the criteria, we would say this person has a major depressive episode, right? Now that major depressive episode could be either part of major depressive disorder or bipolar disorder. Bipolar disorder has both the low end, the depressed end, the major depressive episode end, and really the opposite, the manic end, where they're just the opposite of depressed. They're very expansive, grandiose, talking really fast, racing thoughts, but obviously you can't function on that extreme either. So depending on what the diagnosis is, we would have the appropriate biological treatment.
And that was my next question. How would you treat a person who is diagnosed with bipolar or one of the depressive disorders?
If somebody is diagnosed with bipolar disorder, there are various mood stabilizers that are approved by the FDA to stabilize this individual's mood. If somebody does not have the manic part of the spectrum, but just the depressive part, well, an antidepressant would be effective in treating them.
Now, Dr. Juneja, let us move to the substance-related disorders.
Yes.
Now, how widespread is that in our society?
I would say it's extremely widespread. 23 million people, approximately 10%, qualify or would meet criteria for substance abuse or substance dependence diagnosis. Only about 10% are in treatment. That's in the general population. There's some alarming kind of numbers that came out from Columbia University recently was the amount of drug abuse that's going on college campuses. In fact, it's about 1 in 4 college students would meet criteria for substance abuse or substance dependence, which is about 3 times higher than that in the general population.
That is very sad.
So it's really, prescription pills, Vicodin, Percocet, stimulants like Adderall. Well, my neighbor in my dorm, he's on Adderall, and he actually is able to stay up all night, and he's getting straight A's. Well, maybe I have ADHD too, and it's that kind of mentality. And even the parents on a lot of levels, get kind of, well, maybe you have ADHD, and especially because the child is reporting this. So it's a complex kind of situation. I think the most important thing is to be properly evaluated by somebody who's going to spend the appropriate amount of time, not give you a 3-minute diagnosis, but really spend the appropriate amount of time and work with you and kind of come up with a treatment plan.
And how does one go about doing that, Dr. Janeja? I mean, there's so much information out there. You hear about these treatment centers. You try and reach out to your primary health care provider, and then you get referred out. There are websites. We have the website of Lasting Lifestyles,
right.
And I understand you have a website to Ask Dr. Raj.
Yes.
And it is very important to get that guidance that would be appropriate for that particular individual. So it can become very confusing.
It can be. And I would say, some of the most important pieces is really making the effort, number one. So, we do live in a very information technological kind of time now. So get on the internet, do a search on whatever, just even if you enter the word depression and see what comes up. Educate yourself, I'd say, number one. Number two, access resources. So, for example, your website at Lasting Lifestyles. I did start a website, www.askdrraj, askdrraj.com, where people can write and ask questions. And it's free, and it's, again, the whole idea behind it was to create awareness out there so people can make better informed decisions. But bottom line, make the effort. Get out of the comfort zone. Take that step. Otherwise, life just keeps passing every day.
It sure does, and it's not just a social issue. You need support in making some of these changes occur in your life to bring you to that wholeness and bring you to balance.
Absolutely.
Dr. Janeja, great information and a wonderful way to empower individuals and families in the community to seek the support and help that they need. For more information on mood disorders and substance-related disorders, please log into our website at www.lastinglifestyles.net. Thank you so much.